Good afternoon. It's not quite evening, so that's a good thing, right? My name is Lynne Philley. I am the clinical educator at Rome Hospital. And before I was the clinical educator, I worked in endoscopy. And my dog had just recently died, and my patients all slept on me, and then when they were done with their procedures, they'd all pass gas, and I never got any communication with the dogs, with the patient, because I missed patient care. It really did. So what I decided to do, I have a friend and her mother does animal-assisted therapy and goes to nursing homes. So I decided to try that. So I rescued a dog from a shelter, and I went to lots of classes, and we trained her, and she passed. She's a canine good citizen, and she's been tested for pet therapy, and for the past 5.5 years, we've been visiting nursing homes. We visit two, one in Oswego and one in Rome. And it is so rewarding and fulfilling for me. I think it is the best type of therapy that can ever happen to anyone. I would like to bring it into my hospital. Some facilities already have animals in their hospitals in the acute care setting, but my facility is a little reluctant on letting it happen. So this is my evidence-based proposal to have animal-assisted therapy in the acute care setting. My objectives by the end of this program will be able to identify and define animal-assisted therapy. We're going to list the benefits that it has, both physiological, psychological, as well as social benefits. We'll apply it to the nursing practice, as well as review the literature to make an informed recommendation to put this into practice as an adjunctive therapy for patient care. No, I'm going backwards. The problem: the Affordable Care Act has hospitals scrambling to figure out ways to make patients happy, to make them stay in the hospital for shorter days without having to be readmitted within 30 days because they get a big ding and they're not paid for those hospitalizations. And they also have to maintain patient satisfaction to its highest level. This is all required by the government. So hospitals are trying to find ways and use programs. I know like relation-based care is one that came from it. Our hospital utilizes Studer principles. But I think that the animals can be used to help as an adjunctive therapy as well. Some key terms: animal-assisted therapy, what is it? It's where a trained dog and handler go into a facility, and it is therapy. So when I go, an activity aide does follow along with me, and they write down the reactions that the patients have when I visit, how long the visits were, what the patient did if they didn't want to. Some days, some people don't want animals with them, some love them. And so it's part of their healthcare record. The state requires that nursing homes have X amount of hours a week of activities, so it is required, and this is part of it. And it's actually a free activity that the organization doesn't have to pay for because I come in and I do it for them. Also, hospital consumer assessment of healthcare providers and systems. This is known as HCAHPS. Press gaming is another term that it is used. What it is a 27-question survey that is given to the patients after they are discharged. It's usually mailed to the patient's home. The questions are based on the care. It's the patient's perception on how they felt. Like, there's several domains like communication, was your pain level maintained, did the doctors talk to you? And it is also based on a hospital value-based program, which means that the Centers for Medicare, kind of putting it easily, simplifying it, they have set aside an amount of money for each facility in New York State. And what they will do is based on the patient's reaction to their scores. If they score high, they will give you more money. If they score low, you get less money. So it's in the best interest of the hospital to keep these patients happy. And there's 4 different answers. There's never, there's sometimes, there's usually, and there's always. The patient has to answer always to get the money. If they don't answer always, it's goodbye. So like if was your call bell answered at the right amount of time? If they say yes, sometimes, no, that question is right out the door. So it has to be always for the answers. The purpose of this study is to examine other programs and other literature to see the benefits of hospitalized patients, to introduce animals safely into the acute care setting, and also demonstrate that the implementation of a program like this, in addition to normal nursing grounds, will positively affect the patient's hospitalization as well as increase patient satisfaction. My population is hospitalized patients in the acute care short-term facilities. The intervention is animal-assisted therapy visits with a trained handler and a dog. Also, the comparison is normal nursing grounds and normal nursing interventions. Outcome would be hospitalized patients with improved pain scores, less anxiety, improved hospital length of stay, and also improved patient satisfaction. Which leads me to the PICO question. In hospitalized acute care patients, how does animal-assisted therapy by a volunteer handler and a trained dog, compared with normal nursing rounds, affect pain scores, patient satisfaction, anxiety, and hospital length of stay? Just a little bit of background with regard to animals in healthcare. The first recorded animal interventions is way back into the 9th century. Dogs provided assistance to handicapped members of the community. Back then it was called therapy naturelle. And also in the early 19th century, dogs were regularly introduced into mental institutions and long-term care facilities. This photograph up here was taken in the 1860s. It is a home for demented women. And as you can see in the background, they do have a little dog there that was used for therapeutic interventions. And this is Mary Breckenridge. She is the founder of Frontier Nursing. She did a lot of midwife work in Kentucky. She traveled the mountains and she went by a horseback. She always had a dog with her and a horse, of course. That's what she did, was ride her horse throughout the mountains. And she went to families and did midwife work. She delivered babies. She also did work with children as well and helped improve a lot of that. But she felt that the dog was a good companion for her as well as good therapeutic intervention for the families that she visited. And as she expanded her Frontier Nursing, she got more nurses, and part of their perks was a horse as well as a dog. So they all got dogs for part of their job. They all had a dog for therapy for the families that they visited. My theoretical framework that I'm using for this study is the biopsychosocial model of health and illness. It's by George Engel. And this approach that has 3 interactions which promote the understanding of health, illness, and healthcare delivery. And it's biological, psychological, and social factors. And we're going to see how that all works together. The methodology that I used was using EBSCO-HOST, PubMed. The terms that I used were animal-assisted therapy, acute care, infection, health benefits, as well as disadvantages. In this study, all the articles that I reviewed, they all showed favorable benefits for infection prevention, the biological part of the health, psychological, social, and financial. Using Lobiando, Wood, and Haber's levels of evidence, the articles that I have chosen I have level 2, level 3, and 1 level 5, which all were pretty much quantitative data, which I thought was, I was kind of surprised because the dog is all warm and fuzzy, and I thought it would be more qualitative information, but there was quite a few articles that I have found that were quantitative. So this suggests that it's strong evidence that it is recommended for animal-assisted therapy in the healthcare setting. So applying this back to George Engel's model of biopsychosocial, we're going to discuss a little bit of the biology on how it actually affects human beings by their physiological health. The studies do show that it has decreased blood pressure. When a patient is around a dog, they have taken blood pressures prior to petting a dog or a pet visit and after, and the blood pressures were significantly decreased. It improves sensory stimulation, increases brain function, decreases pain. They actually took serum levels. Cole did a study where she took serum levels of the patients prior to pet visits, and they had a 12-minute visit with the dog. They took levels at 6 minutes, 12 minutes, and also at 2 hours after the therapy session. And the oxytocin levels of the patients were significantly increased just even after 6 minutes with being with the dog. So it relieved their pain for up to 2 hours. It encourages movement. It has positive effects on cardiac markers, and strangely, infection prevention. With regard to that, the animals did not spread disease from person to dog to person and so on throughout the facility. That was from Gandel's. Gandel did a study where Gandel et al. In Switzerland, he studied 460 nursing homes. The control group had no dog visits, and the facilities that had pet visits actually had less spread of MRSA than the facilities that had no dogs. They did not say why this happened. I am guessing when I go out and I take my dog to the nursing homes, I have hand sanitizer with me. The patients have hand sanitizers in their rooms. They know that they can't pet the dog until they wash their hands. So they will wash their hands prior to and after. And we all know the CDC, it recommends the best way to stop the spread of infection is by hand washing. And so I believe that the nursing homes that did do that, they were all more cognitive about washing their hands. Now with the psychological aspects, it did help reduce stress. In that same study by Cole with the oxytocin, they did the same thing with cortisol levels in the blood. And they even did the staff as well with the pet therapy visits. So they did do serum levels of cortisol at prior to 6 minutes, 12, and then 2 hours after. Cortisol levels were all decreased on everybody that had contact with animals. Also anxiety. Shireen did mention the HADS, the Hospital Anxiety Depression Scale. That's how they figured out the anxiety. All anxiety was less as well. It improves their self-esteem and also does help with depression. With the social factors, it reduces loneliness. It encouraged verbalization of the fears of the patients. Dogs are non-judgmental. They love you no matter what you do. And a lot of patients in the studies were more apt to tell the dogs their problems than that they would the nurses. And because there was always a handler there and sometimes a staff member, they would help with their problems and help treat that medically in that aspect. It did encourage patients to ambulate more and socialize. Patients go out into the halls and they'll walk the dog just for something to do, so now they're seeing what's going on outside of their room. Some facilities as well will also bring all the patients into a lounge, and then now they're socializing with their neighbors that they didn't even know existed because they've been in their rooms. and then the dog goes around and visits everybody. So it does help with socialization. So when you put it all together, it creates a shift of focus from disease to health. And it recognizes that all three of these factors will help impact the recovery of a patient. This is just a brief synopsis. We have actually 12 body systems. In all the literature that I did review, it only did mention 7 of them, but we all know they all intertwine and interact with each other. Like the endocrine system that takes care of everything, like our lymphatic system that was never mentioned, or the integumentary system. They're going to be up and about moving, so they're not going to get bed sores or muscle wasting. So it makes them move around. But all these, the literature just in the 6 articles addressed all of these body systems. I do get a lot of, I do get a lot of questions about the digestive system. How does that help? Moving does help with your digestive system. And also one study, Gagnon did a study on children in a cancer facility. And again, it was no dogs, and then the children with the dogs. The children with the dogs participated more in self-care than the children without the dogs. They tended to eat healthier. They would eat, what was given to them by the facility that was more nutritious. The other children were more depressed and they wouldn't eat, so family would bring them in just food just so that they could get something in their system. And it was not always something that was as nutritious. So they did have better nutrition. My recommendations are to utilize national and local pet therapy organizations. With regard to policy, because you do need a policy for everything that you do in a hospital. Therapy Dogs International and Delta Therapy Dogs, they do have sample policies that you can take, and you can format it to your facility and how it would be best for your facility. So that's less work that you have to do. And they also do help with insurance. They cover the insurance. So when you go in with a dog, if something should happen, the responsibility is on the therapy organization, the pet therapy organization. So it's free for the hospital. They don't have to spend any money whatsoever with regard to that. And of course, with any program, you do need evaluations continuously just to make sure that it is working properly. And also using good old Lewin's theory of change, which we've all discussed. Today we're going to create policies, address safety. Safety needs to be addressed for the patients, the staff, the handler, as well as the dogs. They need to have safety too. Infection control would also be monitored, and financial aspects. So Kurt Lewin in 1943, he established this theory of organizational change. 4 different states. There's the frozen, which is the current state of practice. Unfreezing is to create the environment for the desired change. We're going to support that change to the desired state and then reinforce it and anchor it so that it is a new change into the policy, into the hospital. And it becomes their new culture. So applying that with animal-assisted therapy, our current state is normal nursing rounds only. We do not have a plan in place. So what we're going to do is create hospital policy, and like I said earlier, address the safety, infection control measures, as well as cost. We're going to introduce the animals to the floors. To do the change, we're going to support the policy. We're going to evaluate the program with staff, see what they have, if they have suggestions, if we should be doing something different, and also get the patient's perspectives. And we're going to take that information and utilize it to make the program better so that it is good for everyone. And then we're going to refreeze it and make it our culture to have animals in the facility, anchor that change. So with regard to the evaluation, we do real-time surveys. Our administration goes around and they have actually the HCAP scores on iPads, and we ask those questions to the patients to see, and we'll ask them as well how they like the dogs and get their feedback from them. HCAP scores, we would monitor those to make sure that they do go up. Harper, one of the literature reviews that I did do, and I was very excited when I found this. It was just published in January of this year. It was an orthopedic hospital, and they studied just total joint replacement patients. And with that, when they went home, they actually gave the patients, and they monitored the HCAP scores. They gave them the surveys. And the patients that did have animal-assisted therapy all had higher scores than the control group. Patients' testimony, that of course would speak for itself, I believe. Improved pain scores, that would be monitored through chart reviews, and also you could probably look at it too from a pharmacological value to see if there's more narcotics used or less narcotics. And infection prevention, that's monitored anyways on a daily basis, and we would just make sure that it is doesn't get worse. Hospital length of stays, we would monitor that as well, make sure that there's no readmissions. But our performance improvement, they are always trying to get people out of the hospital as soon as they can. So we want to make sure that the patients are healthy enough to go home and can maintain their own, disease process, would you say, at home and not come back within 30 days. So by having a pet therapy program in a facility, I believe all of these things can be accomplished, and everyone wins. The patient wins, the facility wins, no doubt, hands down. This is my dog. Oh, I can't do that thing. This is my dog Maggie, that's her, and this is one of my favorite patients. I'm just going to end with a story with him. His name is Nate, and I visit him on a weekly basis. And I've been doing it for the past 5.5 years. He was one of my first patients. And he does a lot for the nursing home there, and he has grow lights in his room, and he grows plants. And he takes them out onto the terrace and does that for his hobby. But he tripped over, one day I walked into the room, this was probably like 2.5, 3 years ago. He tripped over a bag of soil in his room, and he fractured his pelvis. And I didn't know this, and I walked into the room, and he's usually sitting in this little Barca lounge, and he wasn't there, and I walk in, and he's laying in bed, just stiff as a board, crying, and he told me what happened, and he says, they're not giving me anything for pain, I feel horrible, you could just see in his face that he was in such pain, and they were only giving him Tylenol for his fractured pelvis. And he said, I just don't know what to do. And so we stayed there, and he's petting Maggie, and probably like 30 minutes I stayed with him. And after our visit, he was sitting up into the bed with his feet dangling, and he said, you know, I just forgot that I had a fractured pelvis. I have never, like in the past 2 days, I have never felt so good. This is the best medicine that anybody could ever have given me. That's what he told me, and it was just the most rewarding day I think I've had with my dog. And there's my references, and we're finished.